Health care is a human right. Don't stop now. Don't give up the fight. Health care is a human right. Don't stop now. Don't give up the fight. Health care is a human right. Don't stop now. Don't give up the fight. Y'all feel that? Let me hear that you feel it. Let them hear in Congress that you feel that. You got to make some noise, people. We got to raise the frequency of this fight. I want to really thank everybody for traveling here to Washington, D.C., to the city I know and love. Thank you for making your trek here on behalf of Single Payer. Thank you to Healthcare Now for doing what they do and all the wonderful many organizations represented here. I just recently, as was indicated, began a coalition here in Washington, D.C. called Coalition of the Uninsured and Underinsured for Single Payer. That spells cusp, because the truth of the matter is we're on the cusp of a great change, but we can't stop now. We can't get tired. We can't get lazy. We got to continue to educate people. There's a media blackout as far as single payer is concerned. This is the truth. You, the people, are the media. All these cameras right here, that's wonderful. We have to make sure we get this stuff virally online, use the technology we have access to. Twitter it. I don't care what you do. Facebook, MySpace. You got to get the message out to people far and wide.
Kevin Zeese. I'm the Executive Director of ProsperityAgenda.us.
And why are you here today for this rally?
I'm here to support single payer health care, Medicare for all. We want everybody in and nobody left out. And President Obama's goal was to create health care for all that was affordable and that was good for the economy. He's already lost. No matter what the Congress does, all the bills under consideration will not cover everybody. They will not be good for the economy. In fact, they'll cost the economy $1 trillion. Single payer would actually bring the economy $400 billion a year. Over 10 years, that's $4 trillion, as opposed to costing us $1 trillion. So Obama's on the wrong track. The Congress is taking it even further off track, and it's time to stop, reconsider, and start all over. It's better to pass no bill than the current bill is being considered and start over with a single payer system, an improved Medicare for all, so we can really have affordable health care and something that's good for the economy, not something that undermines the economy further.
Thanks, everybody. We're clearly down to the hardcore, and I'm proud to be with you. Progressive Democrats of America is part of the coalition that came together, and we're proud to stand with the California nurses, with all the doctors who are on the front line with the nurses and Healthcare Now. And I want to thank Katie for a great job. Katie Robbins, thank you. To Donna, as you just saw, who's been a hero for all of us here today and who has stood firmly as part of our campaign for Healthcare Not Warfare. I want to do this very quickly, and I can speak very fast, so I want to just take about 3 minutes. You've heard some great rhetoric today. You know why you're here today, and you're still here despite the heat. You're standing there because you believe that a group of people committed to grassroots change can bring about grassroots change. That's why Congressman Conyers kicked us off today, to let us know we needed an inside-outside strategy. We've got to leave here in 15 minutes and get into the halls where they're going to be voting on the Wiener Amendment on whether or not they're going to adopt 676 into the Democratic plan. We need to go back to our districts and stop talking to ourselves and start talking to our neighbors and make sure when we come back here that we're even stronger. Progressive Democrats of America is not the Democratic Party. We're the Democrats that believe that we should hold Barack Obama accountable to get all of U.S. military out of Iraq now safely and out. We believe as Democrats that we have to stop the escalation in Afghanistan. And as you've heard, we're the Democrats that believe it's time not just to redirect, but to cut military spending to meet human needs and to begin with single payer. Everybody in, nobody out. That's why we say health care, not warfare.
My name is Pauli Miller, and I'm with Healthcare Now. I'm here today to celebrate the birthday of Medicare and to show the powers that be that the people of America want health care, and they want it for everybody, and nobody out, everybody in. And so if it means that we have to come down here in the heat and we have to go and visit people and we have to lobby and we have to speak out, whatever it takes, not having health care can be a death sentence for people. And that's not acceptable in our country. It's just not acceptable in this country. My t-shirt here says money for healthcare, not for warfare, and I'm thinking we have an enormous amount of money that's been going into the defense budget, and people are now complaining about the money that would be going toward healthcare, and we're talking about the quality of Americans' lives, and it should not another minute should go by where someone has to decide between paying their mortgage or paying for their prescriptions.
Okay, thanks so much.
Hey, well, I'm from Maryland.
And give your name, young lady.
My name is Dr. Carol Paris.
And you're from?
I'm from Leonardtown, Maryland.
And why is it important for you to be here today, Carol?
Well, I'm here to stand in support with all of the people who are uninsured and underinsured, as well as all of the people who have insurance and who do not like their private insurance. That is such a bunch of baloney when the president says if you like your insurance, you should be able to keep it. I'm a practicing psychiatrist. None of my patients like their private insurance. None of them like having their co-pays go up, their premiums go up. None of them like being hassled to death trying to get an appointment with me or have it approved and get pre-authorized, and then they have to jump through half a dozen more hoops. People don't like their private insurance. That's baloney.
Okay. Well,
I'm Dr. Harvey Fernback. I'm a physician, psychiatrist here in Maryland with Physicians for a National Health Program.
and why is it important for you to be here today?
Well, I really feel that all Americans should have access to health care, and the only way to do it is single-payer health insurance that's improved, expanded Medicare for all Americans, and get rid of the private health insurers. Their only interest is making money and not giving health care. There are too many people who are losing their insurance, don't have insurance, and have a lack of access to care. And we see it every day in practice. And patients not filling their prescriptions because they don't have the copay, or coming in for needed visits. And it's just a horrible situation, and it's draining our economy. It's bad for business. And it just creates a very, very harsh social anxiety for people worrying about what's going to happen if they get sick.
Hi, thank you. It's so great to be here. You know, I'm a pediatrician, and I didn't really expect to be getting arrested, but here we are. So, you know, for decades, things have been getting worse for patients and health professionals because of the health insurance industry denying care, restricting care, telling us what we can and cannot have. And it finally came to a point where we had to say it's our professional responsibility to no more remain silent. We cannot remain silent and watch people suffer and die. And that's why we stood up to Senator Baucus to get arrested. I want to introduce Dr. Carol Paris, a practicing physician, Mark Dudzik from the Labor Party, and Katie, you know, and who am I missing? Oh, Kevin Zeese from Prosperity Agenda. The others were not able to be here today. They're out working and doing what we do every day. So I had the privilege recently to travel to Iowa with this amazing group there who did an action at the well-marked Blue Cross Blue Shield, one of the major insurance companies in Iowa, who actually, when we looked into their practices, are allowed to deny policies to people based on a symptom of a condition, regardless of whether that condition has been diagnosed or treated over the past 60 months. And that can be a permanent denial of coverage for that condition which hasn't been diagnosed. This has got to stop. We've got to stand up, and these brave people from Iowa did that. So I'm going to ask our youngest arrestee so far, Ms. Frankie Hughes, to tell you a little bit about that action. Thank you. Do this one. Here.
Use this one.
Sorry about the noise.
There you go. You use that one. Keep nice and close.
I am Frankie from Des Moines, Iowa. I will be 12 on Saturday. Me and 8 other people were arrested Monday at Blue Cross Blue Shield, a major health insurance company. We wrote a letter to John Forsythe, the CEO, asking him questions about how much money he makes. He did not answer. We refused to leave until our questions were answered, but instead they arrested us. I did this because other people are out there suffering. The only way we can get health care for everyone is to get health care for everyone. You can do it too. If we don't, everything will stay the same and more people will die because of it. Thank you.